This is an exercise from the Postural Restoration Institute for helping with a correct getting into neutral for a PEC pattern. And it's to help switch off really tight overactive quads and a tight lower back erector spinae muscles. So I need a piece of dowel and I'm grabbing quite close to the center of it. And I'm putting the dowel on the outside of or the other side of a doorway. And I'm stepping away, my feet as close as possible. And I lower myself down this way. So with the arms first, then I start to squat down. And from here with my hands lower than my shoulders, I'm just sitting back. So I'm aiming to keep my heels on the ground, my legs as close as possible. The arms are essentially internally rotated because of the position. The ribs are internally rotated because of the position. And from here, I just breathe. So I'm just gently breathing. I'm not making too forceful breaths. I don't need to breathe into the back. And as I breathe out, I want a long exhale through my mouth. This kind of motion, sound. And as I breathe in, I make the air go into my back, into my pelvis. I don't recommend this if you've got a prolapsed bladder, high blood pressure. You may sweat doing this. This is teaching you how to breathe in a flexed state. Most people are especially if you're in a PEC pattern, you're in an extended state all the time. So I want to hold this for 5 sets of 5 breaths. If you've got a lumbar spine disc bulge, not doing it this time, especially if it's acute. So I'm just hanging off my arms here, letting my quads relax, letting the back go more rounded, become more rounded with the breath. And I'm getting the internal rotation of the ribs to come in. So the ribs start coming in more and more as if it's the position it goes into when you really exhale really well. And what I don't want is my breath to be up in my shoulders where I'm going, well, this. I don't want the breath up in my shoulders, so it's in the back.